Welcome back for another autoimmune question, but this one isn't going to be posed as a question so much as a statement that I'm going to rebuttal. And that is, I can't take Echinacea, I have an autoimmune disease. Or I can't take elderberry, or I can't take, insert the name of an herb, usually immune boosting herbs here. What's the deal with that? Is there truth to it? And where do we go from here? So I would say largely this is false. I'm going to get into it a little bit more in my next video, but for right now, uh, let's just start with this. Echinacea can be bad for some people with autoimmune disease, but it can be marvelously, stupendously great for others. Figuring out where you are on that spectrum can be a little tricky to do, but here's the gist of it, is that if you have a viral infection, so if you have Epstein-Barr virus, CMV, herpes simplex 6, if you've got shingles, if you've got, the parvo, Coxsackie, those are a lot of the common ones. HPV, that's chronically a problem, then you're probably a pretty good candidate for Echinacea and elderberry and Angiographiscus, the typical immune boosting herbs. The reason is that they stimulate parts of your immune system that are good at antiviral killing, uh, which is good if you have a current viral infection. If, on the other hand, you don't have a viral infection and you have an autoimmune process, then it's a little bit more questionable whether or not that's going to be something that helps you. I would say to some extent, you can go based off blood work. So asking your doctor or your functional medicine person to run a CBC with a white blood cell differential, see are your white blood cells low, are some of them high and some of them low, what does that CBC look like? And just having them run for the tests for things like EBV, CMV, etc. Those are going to be useful tools. The kind of final point of this short video, and then I'm going to get into it in more detail next time, is when you're testing for these viral infections and figuring out, again, if you're a good candidate for things like Echinacea, it's important to do the right type of testing. And this is something I could do a whole different video on, but for right now, here's what you need to know. PCR is borderline useless, in my opinion. Somebody in the comments is going to challenge me on that. But when you go to the doctor, you've got a couple of options for testing for viral infections. You can test PCR, polymerase chain reaction, and that's looking for viral DNA in your blood. That is, without a shadow of a doubt, relevant when it is positive, but it's almost impossible to catch positive. And the way I usually explain it to patients is that viruses and other pathogens are really smart, and they don't want to be out wide out in the open for the immune system to gobble up. So they tend to hide in cells and they tend to hide in tissue where they're safer. Looking at PCR testing in the blood is actually looking for something called viremia, which is virus in the blood, and that is very difficult to catch. So if your doctor says, no, you don't have, EBV or CMV or whatever it might be, because we did a PCR test, then they're missing a component of what's going on. The virus is most likely not hanging out, swimming, free floating out in your blood. The other two tests are both antibody tests. Most viruses you're able to test for IgM, as in Mary, antibodies, and IgG, as in George, antibodies. And what you want to look at is if it's IgM, if you have that, those are acute antibodies. That automatically means, yes, it is relevant, and you probably have either had it for a short time, like less than 2 months, or if you've had it for more than 2 months and you have IgM, that actually means a totally different thing. But either way, if you have IgM positive for a virus, relevant, go treat it, you are virally infected. Similar to PCR. If it's positive, it's noteworthy, but if it's negative, it doesn't get you off the hook. Then we get into the IgGs, and those are the ones that are a little trickier. So for viruses like EBV, they have an early antigen. If that's positive, automatically relevant and active. If the other two are the only two that are active, or if like you do a CMV titer and its IgG is positive, IgM is not, then it's really a quantity issue. If that level of IgG is really high, like more than 5, 6, 7 times the lab reference range, then I would personally say, yes, that's relevant and you should treat it. This is kind of a hot topic within the functional medicine and integrated medicine communities, but that's where it seems to be at from my immunology training and talking to immunologists and virologists. That seems where the cusp is. So when assessing for viral infections, you don't want to necessarily assume that you're not going to be a good candidate for echinacea and antiviral herbs if you've had subpar testing. Make sure you get the right testing to accurately assess that. And if you have viral infection, then I would bet you money, if I was a betting woman, I would bet you money that echinacea is probably going to be really marvelous for you.